Australians will need 2 doses of a COVID-19 vaccine to properly protect themselves against the highly infectious Delta variant of the virus. Health authorities are warning.
Norman Swan, presenter of the RN Health Report and the ABC's popular Coronacast, joins us now from Sydney. Good morning, Norman.
Hi, Lisa.
Hey, you and Michael and I are all in the same boat that we're over 50. We've had 1 dose of the AstraZeneca. We've got our second one booked, and it's people like us that Paul Kelly's worried about it.
Well, I don't think he needs to worry about us.
No, well, not worried. He's not worried about us, but I mean, they don't want people to cancel their second vaccine shots. We're all booked in. We're right to go.
Yeah, and I will be too. We'll all go together. We'll go back to MCAC, back to Jeff's shed. So, look, I think that you can understand people's hesitancy here, but the reality is that the risk is incredibly low for the second dose. It's important to get covered. Victorians know that extremely well. New South Wales people are learning that fast. Queenslanders have been reminded in the last few days that we need to get immunised and we need to get protected against yourself and protected against the community. And we just need to get that second dose in. And then later in the year, we may need boosters anyway. But at the moment, let's just get covered.
Now, there is an open debate, isn't there, about, for argument's sake, of people who've had dose number 1 of AstraZeneca and for whatever reason they can't be persuaded, they want Pfizer as number 2, whether you can mix vaccines. We had Paul Kelly, the Chief Medical Officer, on the show on Friday, and I tried but didn't get a straight answer from him as to whether you can mix them. So is it fair to say the health verdict is still out on that, Norman?
Not really. The verdict is pretty much in, although people are waiting for a British trial of this to be sure it's entirely safe. But the data from countries like Spain and others are showing that you actually get a very good immune response. So Pfizer after Astra probably is better than 2 Pfizers. And this mixing of vaccines historically with other vaccines has been shown to be quite effective too. They just want to be sure. I think what they're hanging out for here is just to be sure that it's safe. The problem for people demanding that now is that the doctors and nurses in the clinics giving out vaccines can't do it because they're not covered. There's got to be official approval for it before they can do it. Otherwise, if something goes wrong, they're liable. So that's what we've got to wait for. The trouble is that if you wait for the second dose for the Pfizer, you might be waiting quite a long time because they are going to be prioritizing first doses. And you could be behind in a long line and waiting much more than 12 weeks for your second dose of Pfizer. So I think the thing to do is to get in now, and then as supplies improve later in the year, get Pfizer then. And I just want to burst a bubble with Pfizer, by the way, as well, because there's this kind of magical aura around Pfizer. It's fantastic. It is a high-performance vaccine, no question about that. But there's just been 2 or 3 incidences now where Changi Airport, we've talked about it before, at least 11, some people are saying, I think New York Times is reporting even more than that, of the people who were infected a few weeks ago at Changi Airport had their Pfizer. An outbreak in aged care in Germany, 44 people who'd been covered with Pfizer got infected with the SARS-CoV-2 virus. Now, the thing about both of those stories, which is good news, is that nobody got really sick, particularly the frail elderly in Germany, which means that Pfizer's doing its job. Now, that's the job that Astra does as well. It protects against severe disease. So, and there's very little daylight between Astra and Pfizer in terms of that role, and that's why you're having it now. In terms of preventing infection and so on, as we go further down the line, that's probably why we'll end up with a booster later on.
Hey, Norman, I want to talk about this new data that is highlighting the vaccine rollout maybe needing an overview. What can you tell me about it?
Covered it last night on 7:30. The data are pathetic, really, to be blunt. They're not transparent, they're not detailed. Western Australia, I think, and the Northern Territory, the only 2 jurisdictions which are actually publishing detailed data by first and second doses. Yep. And it took a volunteer data analyst, Anthony McCarley in Melbourne, to dig into the back end of Western Australian data to fish out the national data. His data, this is a volunteer, are so reliable that international groups are using his data in preference to the government's. We should be much more transparent. And I think Lieutenant General John Fruin yesterday acknowledged that there is a problem with data and it needs to improve.
Yeah, it does, and it should not take too much effort, Norman, should it, to get at least those double dose percentages up on that daily data board the government puts out?
Well, it's also numbers, and New Zealand has detailed data. It's got to be by age, by suburb, by gender, to really understand what you're doing so you can tailor the strategy. You can't do it without data.
No, you don't. So hopefully that happens sooner rather than later. Norman, thank you.
You're welcome.